Vaccinations, or immunizations, have been one of the greatest medical and public health achievements of all time. They have saved millions of lives and have spared millions of other people from the devastation of infectious diseases. In the last 50 years, smallpox has been eliminated, polio is on the verge of elimination, and many other dreaded diseases are at an all-time low. And as successful as these efforts have been, new vaccines are becoming available each year so that the potential impacts of vaccines will continue to grow. How has this been accomplished, and can we do even more to make the world a safer and healthier place? Stay tuned and you'll find out on today's episode of A Public Health Journal.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to talk about immunizations, an activity that has saved more lives and improved the quality of our lives more than any other medical intervention over the last 50 years. We'll be looking at some of the reasons why immunizations have been so successful, and we'll be looking at some of the challenges that we face today in using vaccines to make the world a safer and healthier place. Joining us in our discussion today are two Minnesota and national leaders in the field of immunization. Patsy Stinchfield, the Director of Infection Prevention and Control for Children's Hospitals and Clinics of Minnesota, and a practicing pediatric nurse practitioner. Patsy was the first nurse to become a voting member of the CDC's influential Advisory Committee on Immunization Practices. Also joining us is Chris Erzman, the Director of Infectious Disease Epidemiology Prevention and Control Division at the Minnesota Department of Health. Chris serves as the department's main spokesperson on immunizations and infectious diseases. Patsy and Chris, welcome to the program.
Thanks for having us.
A couple of national leaders, Minnesota leaders. Let's start out with a really basic question. Patsy, what's the difference between vaccinations and immunizations?
Oh, good question. I get that once in a while. Vaccination talks about what's in the shot, if you will. So take polio. So you've got the polio virus, you've got some other things in there to keep it sterile, some other products in the vaccine itself. That's what gets shipped to the clinics. Once you give that, you then are developing immunization, which is the immune system's response to that vaccine. Did your body see it, make protective antibodies? In the event you come across someone with polio, those antibodies come out to protect you and you won't get sick. So we use the words interchangeably a lot, vaccination and immunization, which I think is okay. We get it, what we're trying to talk about, but that's the difference.
Yeah, so you immunize with a vaccine. You
Correct.
need the vaccine to get immunized. It's
Exactly.
You need them both.
Exactly.
Yeah. And Chris, why is it important for people to get vaccinated?
Well, as you said it in your introduction, vaccination has been hugely influential in reducing disease incidence in the United States, in Minnesota, and across the globe. And so it's important that people are vaccinated not only to protect themselves from disease, but also because as we vaccinate in a community, that community can also provide protection to those individuals who can't be vaccinated. So it's kind of a joint effort. You're vaccinating to protect yourself individually, and you're vaccinating because you being vaccinated will help protect your community.
Now, I know, we won't go into specific numbers, but I know that, we want immunization rates to be up above 90%, 95%, and we get really disturbed when the rates are at 60, 70%. 60, 70% would seem like a good number to be vaccinated. Why do we want them up at that 95% or more?
Because there's a concept called herd immunity. It's sometimes referred to as community immunity. And what that is, or what that means, is that when we have the majority of people, and by majority we do mean more than 50%, but the majority of people in a community who are vaccinated, then their vaccination helps reduce the likelihood that the non-vaccinated people will come in contact with disease. And so that helps to provide this broad range of protection. When we start to see community protection drop below that 90% mark, that's when we have the potential to see outbreaks of disease.
And Patsy, I know that most people say, well, everybody should get vaccinated, but there are some people who can't get vaccinated, right? And those are the people that we have to really be concerned about. Why can't some people get vaccinated?
That's really true, and those are the patients that I see. I work in infectious disease and immunology, and some of my patients are immune deficient. They cannot take vaccines because they may have a reaction to them. So people who are sometimes too young for a common scenario of measles, for example, your maternal antibodies are still with you as a 2-month-old, 4-month-old, 6-month-old. So you wait until those go away and then give that MMR at 12 months. So all babies for that one, for example, have to wait. People who are immune deficient, people who are undergoing cancer chemotherapy, people who are pregnant, there's some vaccines that cannot be given in pregnancy. So it really requires all of us in the community to keep that immunity up for those people.
So it's really our responsibility to help protect the people who can't get vaccinated.
Absolutely.
Right. And Chris, and I know you work a lot with CDC and also with children's hospitals and clinics and a lot of other providers. Tell me, what's the role of at the federal level, like CDC, the Centers for Disease Control, state health departments, and local providers in the private sector? What role do each of those play?
Well, I think that it's important to talk about all those groups because each of us has a role in making sure that our community is protected from vaccine-preventable diseases. And at the federal level, their role is coordinating programs because each state has a vaccination program, a surveillance program to make sure that we're monitoring for diseases that can be caused by
various infectious
diseases, excuse me, yeah, the vaccine-preventable diseases. But they also are the organization that helps set standards for the country. So you referred to the Advisory Committee on Immunization Practices. That is a group of experts who provide recommendations for the whole country on immunizations. So that's what's happening at the national level. They're helping to set standards for the country on what should be happening, and they administer some programs. At the state level, we help to facilitate those recommendations, make sure they're happening in our state, and we work with providers to make sure they have the information that they need, that they can receive vaccines that they need through federal programs. And then finally, it's the providers that are working one-on-one with the parents, and that's really the key role. That's where the rubber meets the road, and we want to make sure that they have the resources that they need so they can help parents make wise decisions about vaccination.
And Patsy, you're at the two ends of those spectrums.
Right.
You're with the ACIP, the Advisory Committee on Immunization Practice, and a local provider. So how do you see that system working in Minnesota?
Well, I think it works well, and I think that we inform from the local level up to the state and national level, and then also in reverse. When we have national standards, we bring them back to the state and then out to the individual clinicians, because so much taking your journey right down to the patient and where that rubber meets the road are in our clinics, our school-based clinics, our hospitals, where vaccines have to be handled properly, stored at the right temperature, given at the right angle, at the right time, not too soon, not too late. So there's a lot of things that really have to happen correctly for that immunization part, the immunity to occur.
Mm-hmm. All right, well, I'm going to talk about some specific issues because there are a whole variety of issues that always arise with vaccinations, but we need to take a little break first. We'll be back right after this message.
All around town, from grocery stores to playgrounds, babies are on the move. And there are diseases that are on the move too. And some of these diseases, like measles and whooping cough, can spread easily. To best protect him from 14 serious diseases by the time he turns 2 years old, be sure to get him vaccinated according to the recommended schedule. That way, he can go on about his business, and you can have peace of mind. For more reasons to vaccinate, talk to your child's doctor or go to cdc.gov/vaccines.
Welcome back. We're talking about immunizations in Minnesota and nationally with a couple of national and local experts. Chris Eiersmans from the Minnesota Department of Health and Patsy Stinchfield from the Minnesota Children's Hospitals and Clinics. there's a whole variety of issues, as I said, that are always popping up with vaccines, and we'll be able to go through some of them. But one that always comes up is what most people think about, or at least on the professional side, is vaccine hesitancy. You know, why people say, well, I don't really want to have this vaccine, or I want to postpone it, or I want to change the schedule. Patsy, what do you see? What's behind the vaccine hesitancy? What's causing people, particularly parents, to really be a little resistant to getting their kids vaccinated?
Well, I think the first key point is to know how many parents we're talking about. We really, when we look at who is hesitant, it's a very, very small number, maybe 1 to 2% who refuse all vaccines. Very small number. Then maybe 9 to 10% or so will do some vaccines, but they're nervous about other ones. They've heard about this, they've talked to their sister about that, and it's really kind of based on some internal misinformation or concerns they have. But then the vast majority of parents, 80 to 90%, vaccinate on schedule. I think one of the biggest differences has been social media, that people can get in to conversations on Facebook or Twitter, have chat rooms, etc., and perpetuate misinformation. And so I think it's our job, both at a children's hospital, a state health department, and nationally, to make sure that we're giving correct information and leading people to the safest, best thing they can do for their children. And in 27 years of giving vaccines to kids at Children's, I can count only 2 times where a child had to be admitted to the hospital because of a adverse reaction or a severe reaction. And I can't count how many hundreds of thousands of vaccines there are.
The millions.
Millions
Yeah.
over 27 years. And I think that also when in talking to parents and asking them, has your child ever had a reaction after giving vaccines? Nope, little crabby, little fever. Most parents really understand the value of immunization.
Mm-hmm. Now, Chris, I know in the last year there's been this outbreak of measles at Disneyland. And it raised the whole issue of just a few people who don't get immunized because they have different religious reasons or personal reasons or philosophical reasons. It really can cause some problems in the community, can't it?
Yeah, actually it can. What happens when we have groups of people or individuals who would choose not to be vaccinated is then they are susceptible to disease, and so they have the ability to acquire disease and then bring it into the community. And that's what we saw in the case of the outbreak that had been associated with Disneyland last year, that we had individuals who weren't vaccinated who developed measles and then spread that. And even though we have a very highly vaccinated population, the vaccine isn't 100% effective. So we can see, sometimes vaccination in people who are, we can see disease in people who have been vaccinated. But in that outbreak, we saw spread to the many individuals who had chosen not to vaccinate. And that puts all of us at risk. So that's our concern when we have individuals who are choosing not to vaccinate, because as we said, vaccination is not only for us as an individual, but it is for the community. And when you choose not to vaccinate, it's a decision that you think you're making that just affects you, but in reality, it has repercussions for the community.
And as you said, it's a small number of people who choose not to get their children vaccinated. But in that group, is it mostly for religious reasons, or is it for just more psychosocial reasons or social reasons? What's the reason why people choose not to get immunized?
I think I would say that it tends to be more philosophical reasons. And as we were talking about, why do we even see parents having questions, or why are they hesitant about vaccination? I would say that unfortunately, the successes that we've seen because of vaccination are also our biggest challenge. So in other words, you talked about how we've seen all these vaccine preventable diseases reduced in number. Because we're not seeing rampant measles, parents don't see kids die from measles. They don't have that as a reminder to say, wow, I want to make sure my child is vaccinated. So those parents who are kind of on the fence, they may say, you know what, I'm going to choose not to be vaccinated. If they had grown up in an environment where these diseases were commonplace, I don't think we would be seeing this hesitancy. We certainly didn't in the 1950s when we had polio outbreaks.
Mm-hmm. Well, I know as a pediatrician, I saw some diseases early in my career that I no longer see today, which is really a good thing. And it really raised the question, 30, 40 years ago, we had, 10 vaccines. Now we have many, many more. there's some concerns of, well, are there too many vaccines that we give?
Right.
What kind of question, how do you respond to that, Patsy?
That is a common question because the schedule is full. There are many, many more diseases we're preventing. We're really trying hard to get combination vaccines, so the number of injections or pokes that you get will be low, but the number of diseases you're preventing is still high. I think that's been a very good intervention. But I think that the preventing the diseases through combination vaccines and trying to explain to people the value of that is important, because the people who choose not to vaccinate do tend to stay in pockets. And when those pockets are under immunized, and some of it is, that can't be good for you to have that many pokes or that many injections. I try to explain to them the baby's immune system is powerful from the day they're born, because if it wasn't, they wouldn't be able to survive in the world of germs that we live in. So explaining how strong their baby is, that they're capable of taking the number of injections, the number of vaccines that we're actually giving to them. Their body's very, very competent to handle them all at once or according to the schedule. And we really encourage people to stay on the schedule.
And Chris, aren't the vaccines getting better so that we're getting much more specific on the antigens, the kind of things that we put in, so that there's less kind of volume of antigens that the body has to respond to?
Absolutely. If you look at the specific proteins and antigens that the body's responding to, and you look at the vaccines, even though there were a smaller number, about 40 years ago, and you compare that with what we see today, kids are actually getting exposed to fewer of those antigens today, even though they have the potential to be protected from many more diseases. So actually it feels, I think as a parent, it feels like your children are getting so many vaccines, but as Patsy said, their immune system is incredibly strong and able to respond. We say it's like a vaccine is a drop in the ocean compared to what a baby's immune system can really respond to.
Well, I want to talk about other things, particularly flu, because that's also one that adults should really be getting at. But first, we need to take another break. We'll be back right after this message.
You can close the door to cancer. HPV vaccine is cancer prevention. Vaccinate your kids at 11 or 12.
Welcome back. We're talking about immunizations in Minnesota with Patsy Stinchfield from the Minnesota Children's Hospitals and Clinics and Chris Erzman from the Minnesota Department of Health. A lot of talk is really around children's vaccines and children's vaccination schedules, but adults need vaccinations too, and one that we need every single year is flu. And how's the flu vaccine developed, and how do we make sure that it gets a good match with what's going on? Patsy, how are you engaged with that?
Well, I'm on the influenza work group through the CDC, and it's a very fascinating process. The World Health Organization, CDC, and other health agencies around the world watch the circulating viruses, the different strains. Influenza is a very wily virus. It changes and adapts itself. It's a very complex virus. And the vaccine that we have now has 2 A strains and 2 B strains. And so there's a selection process to make sure that we can get in the right strains that will predict looking forward and hopefully have a good match. Now, last year we did not have a good match. And this year we're cautiously optimistic that we will have a better match. We have made some changes in one of the A strains. Last year we also had a difficult year because of the intranasal vaccine. There was a protein piece of it that was determined to be very sensitive to heat. So even just sitting on a dock waiting to be moved into a distribution center or a clinic essentially dismantled that vaccine, and it didn't work well. So we had 2 things, a mismatched strain and a nasal that wasn't our best. Those things have been fixed. We've got a new foursome this year that we're hoping will protect us really well.
And people need to get their immunized every year because the virus changes enough?
Because it changes, and really that's our hope, is there something in all of these different versions of influenza, these strains of influenza, is there a common protein? If we could find that common protein, and there is a little bit of hopeful research on this, that you could give what we would call the universal flu vaccine, that if you got that, you could get it once or maybe just a couple of boosters later. We wouldn't have to do the year after year after year. But that universal protein has been, again, pretty wily and difficult to find.
Chris, Patsy mentioned the fact that the cold chain, the vaccine had to be maintained at a certain temperature. From the time the vaccine is manufactured till the time it gets into the arm or leg of an individual, a lot of steps have to be, there's a lot of places for error. What do you do to make sure that that process is always high quality and that what the high quality that is produced actually gets into the child or the adult?
Well, the Department of Health does a lot of education of providers, and in fact, we have staff that visit provider clinics once every 2 years just to go over with them and talk about, this is how vaccine needs to be stored and handled. We want to make sure that you're doing it correctly. We actually give them thermometers. They need to be checking the temperature of their refrigerator where their vaccines are stored twice a day to make sure that they're maintaining those appropriate temperatures so that the vaccine will be as effective as it possibly can be when it's given. So we're reaching out a lot to providers to make sure that not only are we getting kids vaccinated, but that the vaccine that we're giving them is of the highest quality.
Mm-hmm. Now, and we talk about vaccines and we really think about infectious diseases and preventing infectious diseases, but vaccines can have a broader purpose also, can't they?
They sure can. I think our excitement around hepatitis B vaccine and HPV vaccine prevent those viruses, but the worst cases in those viruses are cancers. And so we do have 2 vaccines at least that can prevent cancer, and in the case of HPV, life-ending cancer at the peak of a woman's reproductive years in the 30s, and when they turn 30 or thereafter. So we really think that it's important not only to prevent the infection, but then the end consequences of cancer for those 2 vaccines.
And if I could add that the HPV can also prevent cancer in men as well. So
Right.
it is a vaccine that, although it was first recommended for women, for young adults, it's also been included for young men because it can prevent cancers in them as well.
Yeah.
So
Exactly.
And also as we were talking about vaccine hesitancy, I know people don't like to get the shot. Mm-hmm. Are there new mechanisms? We've got new vaccines, but are we developing new mechanisms of getting vaccines into people that doesn't require a shot?
Well, I think that is an exciting future. Is one of the hesitancies you have to watch your child get needles poked in their legs, and a little baby, that might be their very first experience with pain. So pain has a lot to do with people just sort of saying, is this okay to do this? It just doesn't seem right. And so with that, intranasal influenza, oral rotavirus, those are simpler, easier to give, and new technologies such as patches, something that would look like a big Band-Aid and have lots of micro needles about the size of a hair that would go in and over time deliver the vaccine. By the time the child got home from the clinic visit, you take the Band-Aid off and the vaccine would be delivered. So those kind of new vaccine delivery methods, I think, are really exciting.
Now, I understand that on the ACIP, this national oversight organization, that had you 2 were the first nurses on the ACIP, and that the 3rd nurse actually has some Minnesota roots. So,
That's right.
Chris, why is Minnesota so far ahead in many things related to immunizations? Why do we have such a great immunization program here?
Well, I think we've had a history of having very proactive leaders in immunization. So Diane Peterson, who really started the program from its inception, and over time we've had really strong leadership at the state level. We also have wonderful providers who partner with us so that we're successful as a state. And I think those things together have allowed us to do innovative activities related to outreach, to do some innovative educational programs, and all those things have helped Minnesota to be cutting edge.
Mm-hmm. Patsy, what do you think?
I totally agree. I think the public-private partnership that we have in Minnesota is outstanding, and I think it's unique. We have each other's numbers in our cell phones. We know each other. We work well together, and not just on public policy in front of the legislature, which we do that often, but in times of crisis. We met each other through the 1989-90 measles outbreak. That's not when you want to get to know your partner, though. You want to get to know them by developing policies, procedures, practices, innovative outreach, going into schools, trying new ways, and really respecting the fact that each of us have an important role, as we described earlier, from national to state to at the clinician end.
Yeah, well, vaccines are so important, so I'm glad you're good partners.
We are.
Yeah.
Good. Thanks for being with us. This has been really helpful.
Thanks for
Thank
having
you.
us.
I'll be back with a closing comment right after this message.
I never get the flu.
My kids don't need more shots.
I don't have time.
We're all healthy.
My asthma's under control.
But I'm pregnant.
I've had the flu before. It's not a big deal.
My kids are too old for flu.
The media is exaggerating.
I can fight it naturally.
My diabetes, it's under control.
No matter how you build your excuses, the flu can blow your house down.
I can't believe I used up all my sick time.
I missed a week of school during finals.
Now my baby has it because of me.
The hospital? Death?
Keep your foundation strong. Vaccinate. Learn more at flu.gov.
A message from the U.S. Department of Health and Human Services.
Each day in the United States, over 12,000 children are born. This means that each day, 12,000 more children are added to the pool of people who need to receive the vaccines that will protect them from serious infectious diseases. Just the sheer number of babies born each day makes routine immunizations a daunting task. And that's not even considering the adult immunization needs. And when you consider the fact that new vaccines are continually added to the list of needed immunizations, you get a challenge of massive proportions. Yet, according to the Centers for Disease Control and Prevention, CDC, over 90% of the nation's 2-year-olds have received their most critical immunizations, a marked improvement from the situation of just a few years ago. This is truly a remarkable achievement and one that must be sustained if we are going to continue to be a healthy society. The reasons for this success are many, but I will highlight just two. One is that a strong public health infrastructure was crucial for the creation and maintenance of a system to develop the right vaccines, assure their safety, and get the vaccines distributed and into the people who need them. This public health infrastructure needs to be maintained if this success is going to continue. The second factor in the success of our immunization efforts is the superb collaboration between the private and public health sectors of our public health and healthcare systems at the national, state, and local levels. Without this collaboration, the successful development, distribution, and use of vaccines would not be possible. The success of our immunization efforts demonstrates that all sectors of our public health and healthcare systems are needed, and all must be working together if we are to maintain and improve the health of our world. Health is the responsibility of everyone. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.